I'm Ed Parham. I'm going to talk about how better understanding place can help improve health outcomes, and I'm going to talk particularly about how the environment enables activity. Originally, I'm an architect. I've been at Space Syntax for about 15 years, and Space Syntax is a spin-out from the Bartlett School of Architecture at UCL. And what we do is we model the built environment and we analyse it to understand how it affects day-to-day outcomes. I also represent another company, Integrated Digital, and this is a Space Syntax spin-out, and it's a joint venture with two other companies. And we apply the technology developed in Space Syntax to domains which are outside of planning and design. Now, the start of this is to really think about place, and we have quite an intuitive understanding that space and place works across lots and lots of different scales all at the same time. I think the difficulty, though, has been how to measure and describe these individual scales in combination, but also the kind of siloed structures that we have around the disciplines and departments and the professions involved in these areas. And what that means is that the dark house in a dark street means that we have an architect who designs a room in a building, we have urban designers who talk about the way buildings interact with streets, we have planners looking at neighbourhoods, we have transport planners looking at the city, and all of these different professions and different groups do all of these things in a slightly different way. Now, what I'm going to show is a particularly focus on the bigger scales, how that can create the conditions that enable people to be active and to take a more strategic view, so it's less detailed within those disciplines and more cross-cutting strategic view of things. Now, the first thing that we do is start to think about cities as a set of systems, and we can think about those systems as being in families. So we can describe urban form as being a combination of street networks, land use, density, public realm, and green space. But there are other families as well around mobility, things like active travel, public travel, and also infrastructure, energy, waste, water networks, all of those sorts of things. Now, each of these systems, it has a job to do by itself, but it also needs to work in combination with everything else. And the really important thing is that it needs to work around the needs of people. To give an example of that, you could design a road network that makes it possible to drive across the city at 60 miles an hour, but it makes it impossible to walk to the shops to buy a pint of milk. And if this happens on one day, it's just inconvenient. But over time, if it happens every day, and people stop walking as much, it starts to have really profound impacts in terms of health outcomes. What Space Syntax have done is to develop a type of modelling that we call integrated urban model. And what this does is it starts to take the individual systems within urban form and mobility, and it can analyse each of them independently, but it can also start to see how they work in combination. So we can take the street network, combine it with pedestrian networks, cycle networks. We can link it to the land use, which is in every building in a city, and we can link all of those things together using a public transport network. Now, what we can then do is analyse from the point of view of every building in a city, what can I get to within a certain time if I travel on foot, by car, by bike, or by public transport. And we can extract from this model a series of different measures. Now, this one that has come up now, this is walkability, and what this is measuring is what is the mix of land uses you can get to within 15 minutes of every house or every building in a city. Red shows that you can get to more, blue shows you can get to less, and this is a combination not just of the land use, but the way the street network and the urban block sizes are all working together to make things closer together, to make it more convenient and easier to walk. This isn't looking at things like the quality of public realm or safety or any of those things, it's just talking about the big systems in a city. And in the last few years, we've started to see more and more examples of these sorts of stories coming out in the press. This is the BBC website a few years ago. People are really unhappy that they've just moved into these new houses, but because of the way that the layout has been designed, they spend the whole time in the car. It's only a few hundred metres from the centre of this town, but it's impossible to get there. They can't cross the dual carriageway because there's no direct connection into the town centre. They have to walk the long way around, so nobody does. There's more and more research coming out about travel behaviour and health outcomes. So British Medical Journal published a paper that shows reduced risk of obesity in people that take public and active travel. And there's more research that's starting to look at the secondary costs of this behaviour to society, and driving cost society, where walking and cycling actually generate benefits. Now, the really important part with all of this is that we've got the data and the models and the tools to be able to analyse existing cities and towns and see, do they put the conditions in place that mean that people will be car dependent or not? So we don't have to build something and then discover that they're car dependent when they've been living there. We can actually see this is likely to happen before it's built, and then we can change it to reduce that risk. We've applied these models in real world projects. We worked on the NHS Healthy New Town of Cranbrook down in Devon, and this was really interesting because it was a project that combined inputs from planning and public health and transport. And first of all, there was a really clear difference in what each of those departments considered an outcome. Planning and transport were talking about implementing a certain number of houses or a certain amount of transport network, whereas public health were talking about what the population living in this place would be like in 10 years' time. Would they be healthy and would they be happy? So to understand whether the master plan created those conditions, we needed to understand, where did you get better health outcomes in Exeter? So we made this integrated model of Exeter, and we have walkability index shown here. The red is the more walkable bits, the blue is the less walkable parts. We gave this to the public health department, and what they started to identify were a set of relationships between health outcomes and walkability. And the one that was really interesting was around obesity. They're finding higher levels of obesity in the less walkable parts of the city. When we make the models, we put it together in a way that we can combine it with demographic data. What this then means is that we can run other analysis on that demographic data. So what we have here is a model of Milton Keynes showing car dependence in blue, and we have combined that with Age UK's risk of social isolation in elderly people. So what you can then start to see is the darker blue areas are the place where you have a place risk. So these are the parts where you really need to have a car to get to the things. The dark grey is showing where you have a population who are more likely to be elderly and vulnerable. So this gives the city a way of identifying we have a place risk and a population risk, and then we can start to think about prioritising what to do about those areas, but also how to do that, because we can understand whether it's a physical condition, if it's the street network, if it's the land use, if it's the public transport. And that's the starting point, really, to think about interventions in a different way. It doesn't always have to be a physical change. Physical change is really difficult to make in a city. Sometimes it can be expensive, slow, really divisive. We can start to think about making a soft intervention, and that could be about a behaviour change campaign, but it could also be thinking about the way that you deliver services. And again, we've combined an integrated model of Greenwich here with some of the NHS open data sets. So we're looking at how many houses can access a GP, but we're then starting to say, what's the capacity of that GP? If it has a bigger circle, it's a higher doctor to patient ratio. If the circle is pink, it means that the patients are recording a satisfaction rating of 75% or higher. So if you live in a light blue house in Greenwich, you can get to at least one good doctor. If you live in a dark blue house, you can get to at least two if you're walking. And so you can then start to see, how do all these factors affect things? But you can then combine this again with the demographic or socioeconomic analysis and say, could we think about increasing capacity? Could we think about improving the quality of service in particular areas? Now the next step is really to be able to use these tools in practice to make a real difference. And the key point here is to be able to remove some of the technical barriers that make it possible for untrained people to really access the data and the insight that we get through these models. Then we've made a series of pilot tools that start to do this. And this is a web-based tool which is really allowing city planners in Sao Paulo to see how easy the city is to live in for elderly people and why that might be. So we can start to break that down to see, does the city make it possible for social interaction? How does it support physical activity every day? Has it got good access to healthcare? Have you got good access to public transport? But you can also start to be really precise about what's missing. Is it that you don't have access to, say, a park or cafes to meet people? We can also start to see how that picture changes as people become less mobile or lower income, and you can start to use this in a way to be able to see risk and to see what happens if our population becomes less mobile and lower income. Where are the high risk areas and what makes it like this? So in summary, We can use open, not always open, but a lot of the time you can use open data and tools to better understand where the environment creates risk and where this overlaps with vulnerable communities. We can use that understanding to shape physical interventions, so where to grow a city and how to grow it, if you are going to add a new bridge or a new connection to an existing city, or how to change the public realm. But we can also use it to make softer intervention. That could be about improving transport or providing on-demand transport solutions. It could be about targeting behaviour change interventions, or it could be about making improvements to the way that services are delivered. Thank you.